1, 2, 3. Hello, mate. Do you understand Irish?
Animals from all over the world
Bonjour.
come to see one extraordinary man who's known as the Bionic Vet,
High five. Yes!
Professor Noel Fitzpatrick.
We only get one shot at this. Here we go.
Noel and his team offer some of the most advanced treatments available anywhere.
The perfect marriage of mechanics and biology. This is what we have now, a brand new knee.
Oh, wow!
For some, it's a last chance.
It is a life or death situation because we cannot leave him like he is.
I just want you to do anything you can for me, really. Sorry.
As Noel continues to devise new ways of healing,
You're going to be bionic. Thank you so much.
he transforms the lives of his patients
Oh, that is just unbelievable.
He's raring to go.
against all the odds.
Boom! One small step for a dog, one giant leap for mankind. Well done.
Scooby, please. Hello.
Now, nibbles, folks, please.
Spongy.
Each week, Fitzpatrick Referrals sees more than 150 pets.
Scrabble.
Okay, princess, please.
Noel will see around 20 of them personally. His first patient today is a 1-year-old Labrador called Simba. He's been referred for surgery with severe arthritis in both hips.
Oh, lordy. Look at those hips. They're not even in the sockets. That's really bad. Sit down.
Sophie and her partner Kostas first noticed Simba had problems when he was 6 months old.
When we took him for walks, he was hopping like a bunny, and we thought it was just because he was a puppy and we thought it was cute. But then when he was crying in bed, we thought, there's something not quite right. We booked a vet's appointment and they did an x-ray and they said it's one of the worst cases they've seen and that they would refer him here to get sorted.
It's not just a dog for us, it's kind of like part of the family.
Sophie grew up with Labradors.
Simba, come on.
Simba is the family's third.
Wait, I've loved Labradors all my life. Yes. But with Simba, I feel like maybe as close as it gets to having a child. And I put his needs before mine, which is insane because he's a dog, but he just brings me so much happiness. When we found out that Simba had been diagnosed with hip dysplasia, I just felt like my world had ended. I'd got like the perfect puppy. He was so stunning, he was so lovely and cuddly. And then to look at him thinking that inside him is damaged and not right, it just made me want to cry all the time. I just can't describe how heart-wrenching it was.
As the disease worsened, Simba's puppyhood came to an abrupt end.
Before, we'd come home from work, he'd be sprinting around the house, we'd have to walk him for ages on a night. Now, he'll stand at the bottom of the stairs and cry because he wants you to carry him up the stairs. And then he'll cry at the side of the bed because he wants you to put him on the bed, and he just won't move all night. So I've just been like trying to massage his hips on the bed.
His hip dysplasia is so bad, even euthanasia was suggested as an option.
Just having him since he was 8 weeks old and watching him develop like a little child growing up, and then when somebody just says, well, you might have to get him put down and lose him, it's as if, why? Like, I love you so much and I've done so much for you. And just... Surgery is really the only resort for me, because if that doesn't work, then at least we've done all that we could do.
Right, Simba, please, Simba.
Thank you.
Hi, how are you? I'm Noel. Hello, Simba. Hi, how are you? Hi, how are you doing? Nice to see you. Hello, how are you? Grab a seat there. So listen, I've been looking at your notes. It isn't good, is it? It doesn't paint a great picture.
They did the x-ray and said that he would need a full hip replacement.
I see. First things first, let me have a look, because everything we do has to be in the patient's best interest. All right, mate, come on then, bud. Let's just see what we got here. Hold tight. Yes, okay, sorry about that. Right, so he's in quite a lot of pain, and I can feel rubbing when I do that. All right, let him go. Thanks, girls, it's fine. Well, he's in a lot of pain. In this case, hip dysplasia has produced two very loose hips. I mean, I would say they're both as bad as each other. I can feel grating, which is bone rubbing on bone.
We hear that a lot.
Yeah, you hear it, you can hear it, yeah. Because you've got no sockets left. They've become saucers. And the other big problem you've got is you've got severe muscle laxity. He'll lie down a lot after walks like this and stick his legs out backwards because that's the most comfortable position to put them in, because he's grown accustomed to the fact that he's in pain every day of his life. Pain management will control the signs to some extent, but obviously won't cure it. So therefore, our only three options are do nothing, chop the femoral head off and throw it away, try and make a false joint, which is called a femoral head and neck excision, or do a total hip replacement. I believe, as does the current scientific literature, that total hip replacement is superior to femoral head and neck excision in a dog of this size. And we know that this technology works and has in fact worked for decades, but you need to understand there's risk associated with that. The primary complications are dislocation or fracture. Infections are rare. Also, when I pull the hip back in, if I have to make it very tense, then this nerve here may have a palsy temporarily. This is very rare, but if you get it, don't be scared. Sometimes they drag the foot for a while. All right, friends, is this your first child?
Yeah.
Okay, well, I will do my very best to look after your firstborn. Okay.
Expensive child.
Yes. Okay, Mum and Dad, give him a big cuddle there. I'll ring you later, guys.
Thank you.
Thank you.
Noel will go ahead with hip replacement surgery on both of Simba's hips.
When he was going through the risks of what could happen, I suppose your heart sinks and you ask yourself, is it worth it, or why me? Why did I end up choosing one that had this, or why has he got that wrong with him? But just got to man up and hope for the best.
Okay, Bubba. All right. Oh.
Emergency cases are referred to the practice for specialist treatment at any time of day or night. It's early evening, and the Richards family and their friends have brought in Poppy, their 3-year-old Cavachon. Earlier today, she escaped from the garden and was run over on a busy main road.
Come and settle in the corner, and I'll pop her back down for you.
Poppy has been given painkillers by their local vet.
Do you need a hand there? This is Poppy?
Yeah, this is Poppy.
Okay. Hello, sweetheart. Okay, come on then.
She seems responsible. I don't know if you can you carry her?
Yeah,
Is this
absolutely.
like
Yeah, got it. Good girl. Come on in, girls, come on in. When did the accident happen, please?
about 10 o'clock?
10 a.m. this morning.
Mum Tina was out at the time, but daughter Megan was at home.
Did anybody see what happened?
Yeah, I heard a scream. There was a lady crying there and she was like, your dog just got run over, and I was like, it can't be my dog. And Poppy came in, I was crying, and I saw her leg and it was like completely broken. It did not look right.
Has the bone come through the skin, do you know?
I don't think
You just
so.
said it was floppy.
It was really floppy.
You saw blood. And you didn't
Yeah,
know
I
where it
saw blood, but I didn't know where it was coming from, and she was completely out of breath. And after that, there was a lovely lady who took me to the vet with Poppy.
Right, so they've not taken x-ray pictures of the leg yet.
Oh, they haven't?
They've taken
Well,
x-ray
we've
pictures
got
of the
internal
chest, yeah.
organs.
They've just checked for life-threatening internal organ issues,
Okay,
which they did not find,
okay,
but we will need to recheck that.
okay. And she doesn't seem to be in pain? 'Cause of the
Well,
methadone.
they've given her a lot of methadone, yeah, so she's a lot of happy drugs going on there. Yeah. Okay, Bubba. All right, guys, that's it. I'll need to establish what's going on and what the prognosis is. So if you want to give her a big kiss, guys,
Oh, love you.
I'll take her now. Oh, okay, guys. There we go. I'm going to take her through. I'll call you later. No worries.
For now, there's nothing more the family can do, so they're going home to wait for news.
So she just had an RTA.
Noel and the team must get straight to work.
I've seen a radiograph of the chest and the abdomen. It doesn't appear like there's any internal organ rupture. We'll repeat that. Get me a craniocaudal and a lateral and take that off.
Just make sure her ECG traces.
Poppy is in a serious condition.
Her blood pressure's through the floor. She's tachycardic, she just hasn't got the circulatory support because she's still shocking.
Drugs are keeping Poppy out of pain, but the nursing team must stabilise her and take X-ray pictures.
It's not good news. The original X-ray picture did not show fluid on the chest, and now there is fluid on the chest, which means the impact will have caused rupture of some of the blood vessels inside the lungs and in the lining of the lungs. We can see here there's fluid collecting all along here. That grey stuff is fluid, and it's leaking up around the lungs on the outside as well as within the lungs. And that means that we are in potentially big trouble, and we cannot anaesthetise Poppy, because if she was to hemorrhage more into her lungs, well, she wouldn't be able to breathe. So that's life-threatening. This fracture isn't life-threatening, but it's a very bad break, and this bit of bone has come through the skin, which means there's infection in here. We can't operate on that tibia tonight, because if we anaesthetize her, she could die because of her lungs. It's too risky. And her kidney values on the blood test are not normal, so that means she's having trouble, probably big trouble.
Today, Simba, the young Labrador, is having his first surgery. He needs total hip replacements on both legs.
Turn on the suction.
Noel is operating on the right one today.
There's the arthritic joint right there. It's all grown in, and it's become a gnarly saucer and not a cup at all. We're going to drill all that out and put a new cup in. This is a tricky one. This is a cup. It's got a honeycomb surface on it into which the bone will grow, hopefully, and a plastic liner for the head.
Once new bone has grown into it, the metal cup should become part of Simba's pelvis permanently. Now Noel must prepare the femur to fit the new implant.
So this is quite narrow, and the reason it's quite narrow is that the marrow canal has been hardened by remodeling, because the femur has never been in the joint properly, and as a result, it's twisted out like a banana. So this is a very specialized stem. You can see that it's got a honeycomb mesh here into which the bone can grow, and there's a hole right up through the neck here, which we're going to put a locking bolt in to stop it sliding down, even if the femur were to try and split. So we just gently guide it in, like so. We put a wire around the femur to stop it fissuring.
Noel screws the bolt through the side of the femur into the stem to prevent it slipping down.
Okay, so this is the head. We pop that on here, and then we're good to go.
Now the leg can be reattached to the new hip socket.
Okay, we're done. So we can see here where the bolt is holding the stem in place, and we can see if we look deeper that the ball is in position down there, and it's inside the plastic socket with a metal liner. And as we move it now, we can see an entirely new hip joint in position. It's tight. It's not going to come out, I would have thought. Alrighty, good boy. Let's go to X-ray.
For the past 48 hours, Poppy, the 3-year-old Cavachon, has been monitored around the clock. She was hit by a car and is in a serious condition with a broken leg and fluid around her lungs, which could cause problems with her breathing if it were to deteriorate. The team have been X-raying her chest every 12 hours.
We can see that there's fluid around the outside of the lung here, all the way up here. That's probably bleeding and hemorrhage, and probably right now that's becoming a clot, because we're 2 days in now. And at the moment, the area of fluid's not getting bigger, so we're not going to place a drain. We're going to let nature take its course, and hopefully in the next 2 days or so, that fluid will resorb. All right, sweetie, good girl.
Noel can't operate on the leg until Poppy's lungs are clearing. Under anaesthetic, she could have complications. But the longer he waits, the greater the risk of infection taking hold in the open fracture.
So we're just gonna change the bandage in the splint just to keep it clean. We know that there's already contamination in the leg, but all we can do at the moment is give antibiotics. It's too dangerous to anesthetize her. That's it, good girl. So the hole that the bone came through is here. At the moment, there's no more swelling, so I think it's perfectly justifiable to continue as we are. She's got lots of painkillers on board. We gotta wait, probably another 48 hours, I would say. Right, that's it. Good girl, Pops. Well done, well done. Good girl.
Out in the car park, there's a new patient for Noel to see. Nina and Mum Alison have brought in their anxious basset hound, Tulie.
We decided to keep her in the car today because she is on the nervous side with the waiting room full of dogs. I just didn't want her being a bit unpredictable in there.
Nina has had Tulie since she was a puppy. She's now nearly 9 and her health is beginning to fail.
A couple of months ago, we noticed firstly that she was holding her tail quite strangely. She wouldn't hold it fully up in the air, things like that. And then when she went to run, she would just scream and then just hit the floor and, you know, she wouldn't move. Took her to my local vet and did an X-ray, established she had spondylosis of the spine. So, I mean, that was quite a bombshell.
At home in Hertfordshire, Tulie is one of Nina's 4 dogs.
Palsy. There we go.
But she's her favourite.
Tulie, she's my world. She's a very loving dog. Come here. She's fun and silly and smelly, but she's been my companion for the past 9 years and I love her to bits. We've had dogs in the family since I was 3.
Most have been boxers, like Bailey. He's Tulie's special friend.
She just is besotted with him, and it's lovely to see because I see how nervous she is with other animals. She just forged this great bond with him. It's just wonderful to see them together.
In her spare time, Nina's a keen artist and paints portraits.
When I'm painting, she sits with me and she'll watch me doing my work and I'll have my music on in the background and she'll kind of be happy with that.
But over the past few months, Nina has noticed a change in Tulie, despite her medications.
She's deteriorating quite quickly. She seems very unhappy and she seems to be in pain. She's not getting better, she's getting worse. She's so inactive, she literally has very little quality of life.
Nina's local vet has referred her to Fitzpatrick's, where she's already seen Claire, one of the neurology team.
Hello.
Oh, hi.
Hi, I'm Noel. Nice to see you. How you doing? Hello, Tulie. Hi, mate. Are you nervous? Are you nervous? It's okay, cheeky chops. All right, mate. It's okay. Yeah, quite nervous, especially of big, strange leprechauns. Yeah. All right, so Claire, you've already seen, and she's filled me in somewhat. Tulie's 8 years and 9 months of age, so not a spring chicken anymore.
No.
On the MRI scan that I've seen, this disc here is so degenerate that it is squishing both the nerves that go to the bladder, the anal sphincter and the tail, as well as the nerves that go to the back legs. Yeah. Additionally, unfortunately for you, the disc in front of that, L67, is also bulging. Yeah. So if every disc in this dog's back is diseased.
Yeah.
When the disc dries out, in the initial stages it just bulges, but then it becomes unstable. So as those two vertebrae become unstable relative to each other, they produce new bone, and that's called spondylosis. And that new bone can in fact squish the nerves even more. Okay. So that is your problem. And if you look at the CT scan that Claire has taken before, we can see just how aggressive that new bone is. There's loads of it.
Tulie's nerves are being squashed both by the new bone growth and the bulging discs.
So, poor thing, she's affected by significant sciatica.
Yeah.
I'm going to have a little look at you, sweetie pie. All right, sweetheart.
You're leaning against me here, huh?
Good girl. Hold tight. Okay, stay right there. Unfortunately, I'm going to put a finger up her bum. I need to check the nerve. I'm sorry, sweetheart. If you were nervous before, you'll be nervous now.
That's all right.
You can feel it like a little string. Yep, that's sore. Okay. Sorry, sweetheart. So she's very stoical.
Yes.
She's in a lot more pain than she's letting on. Now, I know you're in expecting surgery. The reason you're here is if you do nothing, she remains in pain, not being able to get up ultimately, having trouble pooing, having trouble peeing, all of that may well happen in the next several months anyway if we do nothing.
To relieve Tulie from pain, Noel plans to scrape out the contents of 2 bulging discs in her lower back. To keep the vertebrae apart and to stop the new bones squashing the nerves, he'll place a spacer between the last lumbar and sacral vertebrae, and then attach screws, clamps and rods to stabilise 3 vertebrae while the bones fuse together in their new position.
All right, you ready for me to crack on? Now, sweetie pie. Well done, that's it. Now, bye-bye, family. All right, good to see you.
Thank you.
Take care. All right, I'll do my best.
Thank you.
All right, guys, God bless, bye-bye.
When we went through the imaging, it kind of took me aback. I kind of suddenly seemed to realise that it was actually worse than I initially thought it would be. It's upsetting. There's no other way of putting it. She's so stoical that she's really not showing how much pain she's in, and you then realise just how bad it's probably been for a long time.
Do you need to add it to your doofah? It took me ages to learn how to do it, but you get there in the end.
Oh, you're babysitting?
Oh, yeah. It's really cool.
Good work. Is this your first week? Welcome. Thank you. Oh, you've got a very good teacher there.
I'm not.
Natalie, do not be teaching the new receptionist bad habits.
Never, ever, ever.
I'm watching.
It's been 2 days since Simba, the young Labrador, had his first surgery. He's made a quick recovery. Sophie and Kostas have driven nearly 200 miles to the practice from Leeds.
I really can't wait to see Simba again. It's been really hard being without him, knowing that he might be in pain and on his own, and hoping that the nurses are looking after him. But yeah, it will be nice to have him home.
So Simba's doing well. This is the replacement. You can see here, nice new cup, new stem, ring around here. So that bolt will prevent that subsiding. Yeah. And Simba thinks, this is great, we're fixed now, off we go. So you gotta be super careful for the first 4 weeks. But once the bone grows in around that mesh, you should be rock solid in 8 weeks. Then you won't need to worry about it. I mean, run around like a normal dog on this side. Clearly the other side is horrendous. It's the same, basically. So, but I think the strategy is in place for us to deal with that. There you go. Now, probably a lot better than you would think.
Yeah, yes.
Well, he thinks he's fixed, you see. All right, guys, let's go outside. All right, come on, Bob. So, as you can see, he'd run across the field. You must put the sling under him at all times. He can stand and walk without that, but that's an insurance policy. I don't want him twisting suddenly and fracturing something. This is as good as it can be. I'm very pleased with him. Gently. Good boy. All right, big guy. We're going to close the door, mate, because you're going to jump out. Stay. Good boy. Good to see you. All right. Take care. Take care, mate. Behave yourself. All right, buddy. Take care.
Feels really, really nice to have him back. He's doing really well. I thought it would be far worse than this, so I feel really pleasantly surprised. We'll probably all be sleeping in the living room with him tonight while he's in his cage to make sure he's okay.
If all goes well, Simba is due back for his second hip replacement in 4 weeks' time. In the wards, Poppy, the Cavachon who was run over, is being monitored constantly to check if the fluid on her lungs is clearing. Until it does, Noel can't operate on her broken leg, so for now, she's in intensive care, and it's a waiting game. Tulie, the basset hound, is being prepared for surgery. She faces a major spinal operation.
Tulie's op's going to be challenging. It's a very small target area relative to the amount of metal work I'm going to have to get in there to make it stable. I'm not entirely convinced I'm going to be able to get the spacer device in because looking at the MRI scan, it's pretty tight in there. All right, here we go. So the first bit of this op is fairly brutal, where we separate the muscle and drill off most of the roof. The next bit is very, very delicate, where we gently file through the inner layer of the roof, which is eggshell thin. We must not touch the nerves. So this is the roof coming off now, and underneath that is the nerves that go to the tail. This bit of roof here has been squishing down on the nerves. So now I'm going to cut beside the nerves, taking the roof off the disc. There's a ton of disc material in here, loads of it, bulging up for probably years.
With one disc cleaned out, Noel scrapes out the diseased disc from the adjoining vertebra. It's delicate work.
The thing is that you're only ever a millimetre or two away from disaster when you're doing surgery like this, because if you catch one of these nerves, you can really inflict permanent damage. So we've got to be super careful.
Now he can fit the spacer to push the vertebrae apart and take pressure off the nerves.
So this is the scariest bit of the operation, where we're pulling the nerves over. You get this wrong, could be game over. We get it right, and then potentially we get a lifetime pain-free. I knew this would be tricky, but this is very tricky. It just does not want to go in the right spot. We're losing quite a lot of blood now, so soon we'll be having a real problem here if I don't get this screw in. Rrr! Hopefully I've done most of the blood losing now. So finally, I've got the spacer in there, and I've got a tiny screw through it here to stop it backing out.
The spacer will keep the vertebrae apart, but whilst the bones fuse in their new position, they must be supported with screws, clamps and rods.
Okay, so we got 4 of 6 screws in now. We got to get the 5th and 6th one in, and then we might be in some kind of shape. So I'm going to have to cut certain lengths of rod to fit these clamps, because it's an unusual length since I'm bridging between 3 vertebral segments. All the implants are in place now. I've got 3 clamps on each side and a rod bent between the 3 clamps on both sides. You can see here, if I grab the bar here, I can lift the bottom up off the table. I'm just going to put some collagen foam down over that now to cover up the nerves and then stitch the muscles over.
The operation has taken nearly 3.5 hours.
All right, let's go to CT now, please.
Simba, that's great. Take a seat and I'll let them know you're here, okay?
Simba is back at the practice with Sophie and her friend Sarah.
Yeah.
For the past 4 weeks, he's been a challenging patient at home.
Struggled so much to cope with him. He just wants to explode every second. He chewed his entire cage door off in the first 3 days. So I had to order a new cage, but he won't go in it. So between me and my family so far, we've slept in the living room next to him every single night for 4 weeks. Everyone's exhausted. It's just, I suppose, like having a child. So he's put me off.
Right, Simba, please, Simba.
Today, he's due to have his second total hip replacement.
Hi, guys.
Hi.
Hi, Simba. How are you doing? How are things going?
He looks fine,
Grab a
but...
seat. Hello. How are you? Nice to meet you. How are you doing? There you go. Grab a seat. So he looks fine, or are you worried about anything?
He's just, we can't suppress him at all. Like, we've drugged him up to that. Yeah, he's chewed his entire cage door off the first week.
Oh.
And he's just so strong.
I see. So he's probably feeling a lot better on that hip now. All right, let me have a look. Simba, come here. Good boy. Let me have a look. I think you're just going to have to use the sedatives. That feels fine. Hold tight. This one's probably still quite sore. Yeah, I know, mate, that's sore. I know, that's naughty. We'll get you out of that pain. Good boy, it's fine. You're okay, mate. But he looks pretty good, I have to say. I think it's just because he's a nutter. Yeah. That's just... What can you do? What can you do? He's so used to being in pain that when you get him out of pain, he's like, I want to go crazy.
He's trying to go on his back end all the time, like jumping. He's never jumped up ever.
Yeah, well, that's because it doesn't hurt on that side. When I give him 2 bionic hips, he's going to be jumping for the stars. Be like a gazelle, and you're prepared for another month of challenges, right? Yeah. I'm afraid that's life, Sophie. It's just the way it is. You're going to have a shit in my corner now? Oh, my Lord. It doesn't... What? What are you like? There's a big poo in my corner. Look at that.
He's never done that
look, that's what you think of my efforts. What are you like, Simba? You're a naughty boy. All right, guys. God bless. Safe journey back home. Oh, and leave the poo to me. It's all fine. Thank you. See you later. Bye. Bye. Can I have a hand, please?
Yeah, I really didn't expect him to do that. He's never gone to the toilet inside. I think he's clearly remembered what Noel did to him last time, and he's left him a present.
Presents are part of practice life. Cleaning up is a chore for all staff.
Oh, got up my shoes.
After 4 days in the intensive care ward, the fluid in Poppy's lungs is finally receding. Noel feels it's safe now to anaesthetise her to fix her broken leg.
Poppy is finally stable enough to operate, which is a good thing, but we got to get in and out as quick as we can. Keep that anaesthetic as short as possible. Get on me, please. These fracture ends have come through the skin here and potentially got bugs inside here. Normally I would put a rod in the center and a plate on the side, but I don't want to do that. If there is infection there, then that may track the infection up and down the bone. There's definitely a high risk of contamination here. Looks like there has been some impaction on the road. Yeah, we can see a few splinter segments here. Definitely a potential for infection. Give me a swab. So we're taking a sample, see if we can culture any bugs from there.
Noel is going to put 2 plates on Poppy's leg, one to hold the broken bones in the correct alignment, and a second at right angles to stabilise the repair.
So this is a very old style of plate that I first used 27 years ago. It comes in very handy for this kind of operation. Nowadays, plates are much more complex than this very simple one, but for positioning like this, it's perfect. Okay, so we got 2 plates in, one on the inside here, one on the back side here, and they're both at right angles to each other, meaning that it's extremely difficult to bend that. There's lots of different ways we could have fixed this. We could have put a frame on the outside, but I would have had great difficulty lining up a transverse fracture just on an external frame. We're done, 45 minutes. Let's get a bandage on here, we're done. Alrighty, let's go to X-ray, thank you.
Hello?
Hey, I bet you're sitting on hot coals, I would imagine.
Yes, definitely.
Right, so I've done the repair. It went fine.
Okay.
Everything went as planned.
Right. So you think it was infected?
I think it was contaminated,
Okay.
but hopefully not yet infected.
Okay.
And so far everything's resolving in the chest, so we'll just keep an eye on that. We're going to take another X-ray picture tomorrow.
Okay.
So far so good.
Okay.
She's certainly not out of the woods yet, but we can definitely see the light in the clearing.
Thank you, Noel. Thank
Cheers.
you.
Bye-bye. Bye. All right, Tulie. How you doing, sweetheart?
Tulie, the basset hound, has spent the last 5 days recovering from her complex spinal operation.
Hey.
How you doing with your big floppy ears?
She's an older dog, nearly 9, but she's recovering well.
Okay. The girls tell me she's able to urinate and hopefully she's able to walk a little bit better, but we're about to find out. Come on, Bubba. Come on, sweetie. Oh, what a brave effort. What's happening in here? It must be pee time. Oh, yeah, that's what we like. A nice big pee time. Well done, you. Well done. Come on over here. We have a look at your legs. Okay. So she's making a valiant attempt to use her legs. Lots of movement in the leg there. So really strong withdrawal. Really strong motion there, that's good. Oh, poo on the hand alert, poo on the hand. Ah, thank you, Tulie. Well, she's able to poo, she's able to pee, she's able to walk. It's time to go home. Right, Darby, I'll let you do the peeing and the pooing then, because I think she's already started, it would appear.
Nina has come to collect her.
I just can't wait to see her. It's been agony not having her in the house for a week, so I've been a bundle of nerves all this morning.
Hi, Nina, how are you?
I'm good, very excited.
All right, so a big deal, big surgery. That's what the implants look like. That's a lot of metal.
Yeah.
Very challenging anatomy. Now, for the first 12 weeks, until that all sets solid, there is risk associated with too much motion.
Okay.
So just be careful.
All right.
I think the best thing to do now is let's meet outside the front door and I can show you exactly.
Okie dokie.
Now, there we go. Hello, who's there? Who's there? Oh, who's there? Hi. Hi. There you are, there you are. So she walks with this as a support and her tail is beginning to move, as you can see.
Yeah.
So you hold this and this and off you go and take about maybe 30% weight on here.
Yeah.
You don't need to lift her. Yeah, that's it, that's it, that's it, exactly. That's exactly right.
A little bit drunk on the back end. Huh?
Well, she's inevitably gonna be.
Yeah.
This is a big deal. All right, sweetie, come on.
Come this way.
Come on, Bob, come on, Mom.
There
There we go. Good girl. You lift this end.
Yeah.
Okay, come on, Bob. In you go. Good girl.
My head's a bit scrambled at the moment. I'm just overjoyed to see her. I think she's happy to see me and she'll be happy to be home and tucked up in her bed, so I'm just over the moon. I think I'll just snuggle with her for the rest of the afternoon. That's my plan anyway.
In the kennels, Simba has been recovering from his second total hip replacement.
Come on, mate. Good boy.
This time there have been some complications.
Simba's 4 days post-operatively now. The left hip is recovering slower than the right hip did, and that's just the nature of biology. There were two fundamental differences between the left hip and the right hip in terms of recovery. I'll just take this off. One was that there was a big spur of bone at the back of the socket here that was sticking to fibrous tissue, which was sticking to the nerve, and I had to prise that away, and so the nerve has to recover from that. The second issue was that when I put the new head on the femur, I had to pull that right back into the socket, which means the tissue is going to be stretched, and that in turn stretches the nerve. So we get what's called neuropraxia, which is a temporary palsy of the nerve. And that's why we've got this bootie on, because without the bootie, the foot just knuckles over. Generally, they do come back, so I'm not too worried. I think he's ready to go home. Good boy. All right, mate, let's go back in.
I was supposed to be picking Simba up on, I think it was Wednesday this week. And then I got a call from Noel to say that he wasn't well enough to be collected. So it's just been a bit of a stressful week, really.
When I've been ringing you on the telephone, you've been a little bit down about this. Don't feel down. It's all okay. The first thing I need to say to you, though, is if you didn't do this, Simba's going to be in pain forever. I mean, it's tough that he has to go through 2 total hip replacements at such a young age, but we get it right. We set him up for life. Yeah. And I'm confident that the hip itself is fine. Everything should be fine, providing we get a little bit of luck and you do what I ask you to do.
All right.
Okay? So I'm going to move your chairs back. I'm going to put this rubber mat on the floor. I'm going to bring him in and I'm going to show you how to do it. He'll be well boisterous when he sees you, so go down to his level. Come on, mate. Mum and Dad are here. Come on, look who's here. Hey! Now, this is the sciatic sling that keeps his toes up when he's walking along. When he's standing there, this toe will knuckle over. So you put this on when he goes out. That is what the problem is going to be. You look frightened.
I just can't see how that's going to get better.
Oh, well, then you just got to trust me, don't you? Yeah. So the reality is you do any surgery, you can have challenges. You just got to believe that I've been through this however many times, and you just got to have faith. As simple as. Let's walk him out into reception. So as you can see, when he's walking along, it's fine, isn't it? It's just he needs the elastic to hold it up. So just have faith that that's going to recover.
Yeah.
All right, buddy, come on. Where's your car?
Quite shocked, really. A bit overwhelmed.
Okay.
When we get home, definitely spoil him and wrap him up in blankets and just kiss him.
Come back in. Just let's get him in the car. Good. Hi, Poppy. How you doing, Bubba? You all right? Yeah. Oh, you're doing great. Standing up, walking around.
It's 4 days since Poppy had the operation to mend her broken leg.
Got a puppy on her side. Whoop, up, 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 up. Good girl, good girl, good girl. There we go. We've had a bandage on since surgery that we've been changing every day. We want to see if there's any signs of infection. The culture result did not come back showing a major bug, which is good news. Good girl, pups. So there's just a little bit of fluid coming out there still. She's standing fantastically well on the leg. She doesn't know anything's wrong at all. So I would be inclined to leave this open now. Let some air at it. All the swelling's gone down. Plates are working really well. All right, let her up. Thank you. And let's just see her walk up and down the corridor. That's it. Good girl. Well done. Good girl. Good girl. Well done.
Tina and Megan haven't seen Poppy for 10 days. But Noel has been phoning with updates.
We are so excited. I don't know how she'll be, though, because hopefully she'll remember us.
Poppy's doing great, you'll be pleased to hear. She thinks she's fixed. So she wants to run around the field. She must not have any strenuous activity. She can go for as long a lead walk as you like to get her tired. And then she must rest.
Right.
Let's push your chairs back and bring her in.
Yeah.
Now, look at this. How you doing? Oh, hi, everybody. Come on. There we go. Hi, everybody. Now, waggy-tailed. She's walking as if there was nothing wrong.
Okay.
So let's go out to reception. I'll show you how to walk her. Come on, Bubba. Good girl. Pop the sling on her. There you go. So this is more an insurance policy. Off we go. She's walking normally, as you can see. Yeah. So as you can see, she actually wants to run.
She does.
Yeah.
She loves running. She looks amazing. Her tail's wagging. She's really happy. Didn't expect her to look so well.
Go on then. That's perfect. Yeah, there you go.
We'll just take her home and give her lots of loving now.
This is beautiful. I love this. Snowdrops and daffodils are my favorite.
Oh, yeah.
Thank you so much.
Thank you. Bye. Come on. Good girl.
In Hertfordshire, it's been 6 months since Tulie had her spinal operation.
Go, Tulie. Go down here. Good girl.
Basset hounds rarely do anything in a rush.
Tulie.
But 9-year-old Tulie is getting stronger every day.
Come on, Tulie. Come on.
She just seems so much happier. Her whole personality is kind of lifted.
What are you doing? You're up.
She can run around again and she can use her tail and she's pain-free.
Come on.
I just feel I've got my dog back, but there's just a bit more to it, so it's been remarkable. I don't believe she would be here today if we hadn't have had surgery, so it's smashed my expectations.
Your paw too? Yeah.
I just feel so much closer to her in a way that I'd never thought possible before. So she's just a big part of my heart, and I just feel like I've got my dog back again.
Come on.
In Surrey, Tina, Megan and Snoopy have also got their friend back.
Poppy, come on.
It's been 4 months since she was hit by a car.
Poppy's doing really, really well. At one point, we weren't even sure whether she was going to survive, whether she was going to lose a leg. Stop pulling. Good girl.
Now she's just completely fine. She's just as if nothing's ever happened to her.
No, 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 you can't chase the baby rabbit. She's got all her confidence back again and she's raring to go. Look at you, clever girl. It seems like she's got more energy. She just runs and runs and runs, and I guess she's just enjoying the freedom. Whoopsie, come on. Look at those legs. It's the best gift that we could have, just to see her back to her old self. She's just been given another chance of life and she's enjoying it. Oh, she's in.
The locals call it God's own country. In Yorkshire, Sophie and Kostas have got their puppy back.
3.
Simba is amazing now. He just doesn't stop running around. And we feel like Noel might have put a motor inside him. We're just exhausted all the time, but in a nice way. Now he's leaping like a salmon, which he never used to be able to do before, jumping all the time in the air. It's just a miracle to see what he can do now. It highlights how bad he was before. When I see him running around now, you would just never believe that all his back end is bionic. It's just unreal how it's been so successful.
He's one of us, he's part of the family, and now that he's fixed, it's 100% worth it.
Just seeing him happy and being worry-free just means the world to me now.